Welcome to ECTRIMS 2024.
Your Majesty, ladies and gentlemen, it is a true honor to stand before you on this significant 40-year milestone.
So I'm going to talk about two diseases associated with antibodies to aquaporin 4 and MOG. These are both extracellularly expressed and therefore they're amenable to antibody attack.
So why are we so interested in the diagnostic criteria? There are a number of reasons, but one is that there is a clear impact on patient-doctor dialogue in treatment decisions.
Perhaps in the future, or hopefully not too distant future, we could identify prodromal MS with a threshold of certainty.
How you define the relapse is very important for understanding the whole clinical course of multiple sclerosis, including what we would call HERA.
Direct from Copenhagen in Denmark, you're listening to the ECTRIMS podcast, a scientific sounding board for the MS research community and the official podcast channel of the European Committee for Treatment and Research in Multiple Sclerosis. This September, approximately 8,500 MS researchers and experts from around the world have come together in Copenhagen and online for the 40th ECTRIMS meeting. As always, the goal of this meeting is to allow the MS community to meet, share, and discuss the latest research findings related to the pathogenesis, diagnosis, and treatment of MS. Ideas will be raised, collaborations will be formed, and new research directions forged. Today, we bring you the key highlights of Day 1 of ECTRIMS 2024. Today, I'm joined by Bruno Stankoff, Professor of Neurology at the Sorbonne University in Paris and Hospital Pitié-Salpêtrière, and the Vice President of ECTRIMS. Bruno, thank you for joining me.
Thank you very much. Hello, everybody.
So as I said in the introduction, it's a very special edition of ECTRIMS this year, being the 40th anniversary, and that was really highlighted in the opening session today. I wonder if you can just talk to us firstly about what it means to have been part of the opening of such a special event and some of the fantastic parts that formed part of that opening.
Yes, of course, it's a special event because it is this year the 40th anniversary of ECTRIMS. Since the beginning, 40 years ago, the thing has evolved a lot, and we have celebrated this morning. And this opening ceremony was really impressive in many ways, but I may highlight two. One of these was a very deep dive into the past, looking at what happened during this 40 years in a video showing the start of ECTRIMS 40 years ago, when it was a very small meeting, and looking at the constant evolution of this meeting that is now the largest meeting on MS worldwide, and that is continuing to evolve. Mm-hmm. So this was a very important point. The second one was the presence of the Queen of Denmark, who assisted to this opening ceremony. And this is very important because this is not just because of royalty, but Her Majesty has been involved in MS since a long time. Indeed, she has been at the head of the Danish MS Society for 65 years. Mm-hmm. So it's a huge piece of history in local MS research, who assisted, who supported everybody today. And it was really a great event to face to the past, to the present, and to have Her Majesty present on site.
Yeah, it was a very special opening, and I think seeing the early stages, 40 years ago when I think it was said that, it's a personal invitation of maybe 50 people who attended, and then looking through around a lecture theatre that was overflowing with people today was quite an amazing experience.
Absolutely. And we looked back to this starting of the event. Indeed, it was a few dozen of persons who wanted just to connect and to exchange about what could be the future of MS. And we went back to what has been done and initiated by Otto Hommes, who was, let's say, the founder of this first meeting. And we were lucky enough today to have on site the presence of Otto's family, especially his daughter, who was here assisting to the opening ceremony, but also who helped us a lot to reconstitute the past and to explain what was the initial vision of Otto Hommes 40 years ago.
And I think what came through is, and I think you were the one that said it, around how proud he would be of what has eventuated.
Clearly, at the beginning, it was so different. Looking at where we are now, a meeting with 8,000 people connected, and this connection all over the year around ECTRIMS would have been very impressive. And of course, all the pioneer person who initiated this, and especially Otto Hommes, would be very proud to see what it has become. Yeah.
And I think even though it's gotten considerably larger, some of the key reasons behind those meetings 40 years ago around connecting, coming together, discussing ideas, they still underpin exactly what ECTRIMS is 40 years later.
It is the basis. It's a different scale now, but it is the basis, to exchange, to share data, and to think about the future. We are still doing the same, sharing a lot of data because we have more data now, more science, but we are looking for what will happen in the future.
In the next 40
and
years.
how we'll solve this problem in the next 10, 20, and maybe 40 years.
Yeah. Good to always look ahead. And I guess one of the things that we shared in part of that opening session was the ECTRIMS lecture, which was given to us by Professor Jackie Pallas. Yeah. An excellent summary of, I think, some really important areas that are becoming a bigger part of what this conference is. Be interested to hear your thoughts around that lecture and some of the key messages that you took from that. Yeah, we had the opportunity to listen to this great lecture. And actually, it's a kind of continuity and a very good illustration of how ECTRIMS evolved. Because this year, for the first time, we had initiated a new day before ECTRIMS, which is devoted to thinking, research on antibody-mediated diseases. And it has been a great achievement. And in continuation with this, Jackie Pallas, who is a neurologist very well-known based in Oxford, who spent a lot of time to work on NMOSD and MOGAD, has developed what has evolved towards or during the 20 past years in this field. Interestingly, this year is also the 20th anniversary of the isolation of the first antibody characterizing neuromyelitis optica, which is a double anniversary. Yeah. And so with Jacqueline Pallas, we have made the journey seeing all the evolution that happened during these past 10, 15 years in terms of diagnosis of those diseases, which are complex conditions, in terms of evolution, prognostic, and finally treatment. And we can highlight a few points, but interestingly, what she has done is to underline what is similar and what is really different between multiple sclerosis and these other antibody-mediated condition. And there are key differences in terms of diagnosis. They have a different clinical presentation, and we know now are able to really accurately diagnose them, or more accurately, let's say. In terms of biomarker, because those diseases are characterized by the isolation of blood or CSF biomarker. And we have a more complete picture about this. About their intrinsic mechanisms. There are inflammatory disorders that may result in myelin damage, but the mechanisms underlying this are a bit different. For instance, she insisted a lot about the role of complement in the cascade of damage, especially in NMO, which is key because it has opened a very promising perspective for treatment. She also underlined how the damage is done in the CNS and what are the differences, and the differences also in terms of evolution. And a key feature of this is that MS is a progressive chronic condition. NMOSD and MOGAD are maybe chronic diseases,
but there is not such a progressive component, which is a key difference between MS and those diseases. By contrast, when you have a relapse for NMOSD, for instance, the damage might be even more acute, even more severe in the CNS. And this is an emergency for the treatment. And she highlights very well also the urgent need to decide of an accurate treatment following a relapse of this condition. And finally, we have traveled across all the therapeutical progress that have been made to treat this condition. And especially in NMOSD, we have now new, very promising and very powerful approaches to prevent relapse. And we are changing life. We are changing the prognosis of this disease. However, she also pointed that we still need a lot of research around this, because there are many things that are not yet well elucidated. And we have still to work a lot to understand whether that might be new biomarker for helping diagnosis or prognostication, adapt our therapeutic strategies, especially for MOGAD, where it's not so clear how we can treat MOGAD for the long term. So it was a huge journey across these very interesting and fascinating diseases.
Yeah, no, I think she did a fantastic job of being able to walk through what is obviously a massive topic, but to really take it from start to finish. It was a very interesting lecture. Beyond that, other sessions today, it's obviously a massive day in the calendar, many, many sessions.
Yes.
What were some of the other sessions that you attended today and some of your thoughts on those?
It has been a very great day with very important communication. I will highlight first a session on diagnosis criteria, because this year is a year of renewal of those diagnosis criteria for multiple sclerosis. And this has been present during a full session, and the clinical trial committee, together with ECTRIMS, has set up a new set of diagnosis criteria, which I will not detail everything here, but they will help us to simplify some aspects and to adapt the diagnosis criteria using a set of criteria that might be specific and that can be used depending on what is needed according to specific situation. So they are a little bit more flexible. They are more easy to apply early in the disease course. And a key highlight is also that we have integrated the radiologically isolated syndrome in some condition, in some situation within the diagnosis criteria of MS. So we'll now move from RIS to real MS, but biological MS. So this is a kind of breakthrough in our conception of the disease. So this has been a very important session. We heard a lot during the coming days, weeks, and even months about it. We heard also about, let's say, other perspectives for the disease, such as neuroprotection, what has been achieved and what remains to be done. It was a very interesting session. We had the presentation of new biological mechanisms that may drive progression of the disease, such as a kind of dysregulated dialogue between astrocytes and microglial cells, with new compounds that may target this dysregulation and that may be applied in new trials. We heard about the energetic dysregulation in the disease and how it can be applied to therapeutical trial. And we heard about a global overview to improve the chance of success of our neuroprotective approaches, because up to now, many ideas, many concepts, but we still need a strong clinical result for patients.
I think one of the key things that came out of the neuroprotection session, which I've already picked up as sort of been a key theme across the conference, is a need to ensure that we are conducting trials in a way that gives us the best chance of success. I'd love to hear your thoughts a little bit. And I know you personally talked on that a little bit in that session.
Yeah, this is really important because it's a big issue, to prevent neurological disability, which can be very slow. So you need time, you need power, you need big studies. And we have many targets that can be applied for our neuroprotection trial. So it's a huge field. And what we discussed is how we can maximize the chance of success by looking at the right group of patients, at maybe earlier phase of the disease, applying target engagement outcome to be sure that our intervention is followed by a real biological effect before waiting a clinical outcome that may take years to become positive. We discussed a few concepts about what could be the delay between a therapeutic intervention and the clinical benefit of it. And this should be elaborated more in depth in the future. And all of these concepts applied to the trial design that we may use for coming studies may help the chance of success and may let the field grow more, let's say.
Yeah, no, really important. And I think we're going to hear more on this topic across other sessions across the next 2 days. Okay. Thinking ahead, feel like we've already covered so much on day one.
Yes.
We still have days 2 and 3 to go in the calendar. What are you most looking forward to hearing about over the next 2 days?
There is still plenty to come, of course, and this will be very exciting days. What we can expect is first, key therapeutical result that may change the life of patients in the coming months or year. So we are particularly excited to listen from therapeutical trials, such as the one on vitamin D at the earliest stage of the disease. And we know that this will be presented tomorrow by Eric Touvenot. Another big result will be the presentation of phase 3 inhibitor of Bruton tyrosine kinase, both in relapsing MS and in progressive MS. And we heard some preliminary, let's say, information suggesting that it will be a great result. It will change a lot of conceptions that we had before. So this will be key result. And also, we were discussing about neuroprotection, and we may have other therapeutical results of study targeting neuroprotection, such as the one on statin. So a big program from the therapeutical perspective. But I know also that we'll have great results in the imaging field and biomarker field with new algorithms that can be applied largely on dataset and that may add specificity to what we are currently doing and many other possibilities through imaging and fluid biomarkers. And it's not the only one. We'll have also a lot of pathology, mechanistic results, and so on. It will be a large program.
Yep. I think you've highlighted one of the biggest difficulties of the conference is choosing what sessions to go to when you have so many great presentations happening simultaneously.
This is true. As this is a very huge conference, now you cannot assist to everything during your presence on site. And this is why it's very useful to come back to the library after, because you will have access to most or to all presentation. And ECTRIMS is not only 3 days on site or 4 days on site. It's also all the work you can do after to capture all the information that have been presented. And even for us, it will be a hard work, but we'll look at everything.
It's much better to be in this situation with so much information to be presented. Look, Bruno, thank you very much for giving up your time today to share these insights with us. Really valuable. Enjoy the rest of the conference.
Thank you so much.
And thank everyone for listening. Please join us tomorrow as we continue with this special ECTRIMS 2024 series, highlighting all the essential research elements of the day. Once again, I'm Brett Drummond, host of this podcast episode and co-founder of MS Translate. The ECTRIMS podcast is produced and hosted in collaboration with 2 key partners, MS Translate, an independent resource centre that aims to simplify the complex wealth of information about MS for the greater MS community, and the MS Journal, a peer-reviewed international journal that focuses on MS, neuromyelitis optica, and other related autoimmune diseases of the central nervous system. The 2024-25 ECTRIMS podcast series is supported by educational grants from Alexion AstraZeneca Rare Disease and Novartis. Educational grant providers have no input in the podcast content. You can subscribe to the ECTRIMS podcast on all your favourite podcast channels, including Apple and Spotify. Visit the official ECTRIMS 2024 website to learn more about the ECTRIMS Congress and join the conversations on X, formerly Twitter, LinkedIn, Facebook, and YouTube.